We are learning more about COVID-19. Doctors are discovering the virus can do serious damage in other places besides the lungs. Fox12's Simon Gutierrez is live in Northeast Portland with how one local doctor saved a patient by fixing damage to their heart. Simon?
Yeah, the patient came to the ICU suffering from shortness of breath, but the more pressing issue was an dangerously abnormal heartbeat. Known for wreaking havoc on the lungs, COVID-19 can also do serious damage to the walls of the heart, causing it to beat irregularly.
In this particular case, it was a very slow rhythm that was brought to my attention, and the patient required a pacemaker.
In most patients, Dr. Manish Mehta would have installed a pacemaker in the patient's chest, but in a patient with COVID-19, he says that would have been risky.
The issue that can happen is that when we use electrocautery for patients like that to, install the pacemaker, the smoke that comes out, we can inhale that. And that can put us at risk for COVID-19 as well.
So Mehta opted to try a newly approved procedure and installed a tiny pacemaker the size of a pill.
We actually go from the groin area through the femoral vein, go up to the heart. We were told by the manufacturer that this installation was the first one in Oregon for a COVID patient.
Mehta says while Oregon hasn't seen many COVID-19 patients with heart issues, data from China shows as many as 44% of the patients who needed intensive care had cardiac arrhythmias. More recent studies have shown COVID-19 can also damage other parts of the body.
It can affect the blood vessels, it can cause something called vasculitis, can cause blood clots that we've been observing as well. We're still learning a lot about this virus.
And with cases rising locally and in other states, Mehta says now is the time to take the virus seriously.
I've heard stories from my colleagues in New York, and they're quite scary, and I'm sure all of us have heard them. And there are times where you don't get a chance to save these patients, and we don't want to be in that situation. So I urge the public to take all precautions and protect themselves. I mean, this will pass. This will pass. We just have to protect ourselves during this time.
As for the patient, Mehta says they stabilized after he installed the pacemaker, but it will take some time to fully recover. Reporting live in Northeast Portland, Simon Gutierrez, Fox 12 Oregon.